Hello, my name's Joseph Ripley's. Unfortunately, I never took a picture of my first skin cancer on my nose, so here is the second skin cancer. The area was only the size of a pinhead and was slightly red with dry scaly skin. After applying the ointment, this then demonstrated the iceberg analogy. It covered such a large area. As you can see in this next slide, where the circles are is where subsequent application of the ointment removed other skin cancers. Now that slight indentation at the tip of my nose is where the first skin cancer was, the infiltrating basal cell carcinoma. In this next series of slides we demonstrate how the ointment is applied with the flat edge of a toothpick. Then we place a cloth bandage over the area to keep the ointment moist and to stop it from accidentally being removed. 24 to 36 hours later we remove the band-aid. Now, if the skin cancer is active, we should see evidence of this, because the skin would have blistered and bubbled up. This won't happen if there is no active skin cancer there. As you can see, the area around the wound actually gets very red. This passes in a few days. Now we see as the days pass, the area scabs over. This scab must be left on to protect the wound from infection. When the wound is healed, the scab falls off by itself, leaving new skin in place of the skin cancer. There normally is left a small scarring. At least you still have that area. I would have lost my nose to the Mohs surgery had my friend Gary not introduced me to the ointment. Now I'm convinced of that. See how the skin around the area is improving every day, to the point where it's almost non-detectable. I once made the mistake of removing 21 skin cancers at the same time. Now this can be quite a painful process, especially if you remove them off your back, your side, your neck, your arms and your chest, because you have nowhere to lie down on. The next few slides actually show some of these areas that were treated. The next lot of slides we demonstrate the technique for applying the ointment to the back. You may observe different scarring to my back. That's from the removal of different skin cancers. The large one over the spine has had different sections become active at different times. We have to understand that even though we remove the skin cancer, it is gone completely. But when you get burnt, you don't get burnt in just one small area. You get burnt all over. So we're fortunate that the skin cancers only become active one at a time. So consequently, you may find in 6 months or 12 months' time that a skin cancer becomes active near the area where you just removed one. We hope that this video has been of benefit to you, so please visit our website at www.digitalsolutioncenter.com and browse around our site. That's www.digitalsolutioncentre.com.